I'm Dr. Sean Costello from the Harvard Veterinary Clinic, and we're going to go ahead and do an annual wellness check and immunizations for Sienna. Sienna is Renee's dog. Renee works at the Harvard Veterinary Clinic, and Ashley and Heidi are going to help us because Sienna is a very big dog, and she's kind of nervous about this whole thing today because Mommy decided to go ahead and take off to the grocery store for a little bit because she was camera shy. So we're going to go ahead and check over Sienna. And first we're going to go ahead and perform a wellness check, which is to go ahead and make sure that Sienna's overall body systems are in good order. We're going to go ahead and check over her skin. We're going to check over her eyes, her nose, her mouth. We're going to go ahead and examine her heart for any abnormalities such as arrhythmias or murmurs. We're going to go ahead and feel around her tummy for any types of lumps, bumps, or abnormalities as well. And we're going to go ahead and check over her mouth and her teeth and everything else. It's because she's got a big dog here. Okay, now, first off, we're going to go ahead and check the CC in this teeth. She's got very, very nice white teeth. We'll check these guys to make sure that we don't have any problems with dental disease. Once again, Sienna's got some very nice white teeth. At the same time, we go ahead and we check their gum color. She's got nice pink gums and the appropriate color. When we blanch them out, they go back to their normal color very, very quickly. So that indicates Sienna's very well hydrated. She has a pretty good cardiac function as well. Once again, white teeth, nice young dog, and she's got wonderful breath here. Okay, then we go ahead. No discharge in her eyes, as you can see. We have normal appearing eyes. There's no abnormalities in color to her sclera. They're very, very alert. She responds to all the stimuli. We tap on the sides of her face, and we can go ahead and check and see if there's a normal brain function and nervous tissue function by tapping on the side of her face, nose. We grab their tongue, and she can lick her, pull her tongue back. We check in her mouth to see that Sienna also has normal tonsil size. Lymph nodes are okay as well. The lymph nodes are located under the angle of the jaw and pooch. So we're going to go ahead and move further on back here with Sienna. The lymph nodes appear to be normal that are in front of the front legs. She has no lumps or bumps present on any of her neck, top of her head, by her ears. Her ears are clean, by the way. They look real good. So we're going to move on back and check to make sure. Heidi and I will switch sides here so Sienna doesn't decide to jump off the table. She's a little nervous. So what we're going to do now is I'm just going to move back to her thorax. We're going to listen to her chest, as I said before, to go ahead and see if Sienna has normal heart sounds, if there's any arrhythmias, which are abnormal beats. We're going to see if she has any murmurs, if everything sounds fine. If there's any squeakiness in the chest from evidence of respiratory disease, whether it's from allergies, whether it's from infection, or earlier stages of heart failure or any of these other issues. Obviously, Sienna has none of these because Sienna looks to be the perfect picture of health. So we're going to go ahead and listen to her ticker here and her chest. And very, very normal. And she's not as nervous. Her heart rate is pretty normal. Sounds great. She's not as nervous as she looks. Okay. Now, that all sounds fine, and it should, for a nice young dog like Sienna, and she's in great health. According to Renee, there's been no changes in Sienna's water drinking and urination habits, and those are the things that we also monitor in dogs and cats on our wellness checks. We're looking for evidence of early stage kidney disorders, diabetes, adrenal gland disorders, things of that nature that will go ahead and start to cause the animals to drink more and pee more. As you can see, Sienna's starting to become more and more accustomed to being examined here. She's no stranger to the office. She's no stranger to Heidi and Ashley either. So once again, we feel in their abdomen for any types of abnormalities, whether it be pain, whether it is enlargement of the spleen, liver, any abdominal masses, whether it be bladder, kidneys, etc. So we usually just go ahead and do a quick abdominal palpation on these guys to see if there's any abnormalities noted. We also check to see if their back looks normal, if there's any lumps or bumps, appearances of abnormality with the spinal vertebrae. We look to see if the animal has the proper locomotion, whether it looks like it's been favoring one leg or not, losses of muscle mass, abnormalities as far as lumps or bumps within the legs themselves. Okay, so everything looks great with Sienna. Okay, her tail looks pretty good. Her back legs appear fine. And once again, there's nothing that we can really see wrong with Sienna. So Sienna looks great. And we perform the wellness exams on every animal on an annual basis when they receive their immunizations. We also recommend that the animals receive these on a 6-month basis, just to go ahead and follow along the progress in the dogs, and it particularly becomes more and more important as the dogs reach the age of about 7 or 8 years of age, because things change very rapidly. We got to remember that dogs' lifespan is only in the area of like 11 to 13 years, and as they get past about 7, things start happening, and it's just the same thing as people. As they get a little bit older, we have to watch for their health and be a little bit more vigilant on that. So we do recommend that on a semi-annual basis as well. Now, what we're going to do with Sienna here is we're just going to go ahead and administer 3 immunizations. She's going to receive her 6-way distemper injection that has leptospirosis, bordetella, and we're going to give bordetella as well. So we're going to go ahead and administer these immunizations. She's going to get a rabies shot as well. We're also going to go ahead and draw a heartworm check on Sienna, which includes an early detection profile that we will also check for white cell count abnormalities, red cell count abnormalities, and liver kidney function, as well as blood potassium levels and platelet functions as well. So we're going to go ahead and do these injections right now. We're going to administer these in Sienna's leg here, our sweetheart. There we go. Okay, that was her distemper and hepatitis parainfluenza. Okay, we'll go to the other side for her rabies. Okay, Sienna. Okay, very good. So now she's received her rabies injection. And the bordetella inoculation goes in their nose. We use this because Sienna is present at the Harvard Veterinary Clinic, and all our patients receive bordetella immunizations on admission to the clinic because we just don't like to have the animals exposed to kennel cough. We run a hospital. We want to make sure that all the animals are healthy when they come, healthy when they leave. And we don't want anybody getting kennel cough, which is an infectious bronchitis, so we make sure that all our patients are treated with that as well. So that goes right down the nose. And you'll lick their nose and a little snort, and Sienna's all set. Now, finally what we're going to do is draw a blood sample from Sienna for her early detection profile, which we do on an annual basis because that contains our heartworm test as well. Okay, now what we're going to do is we're going to draw a blood sample from Sienna here, and we're just going to go ahead and use her big jugular vein. You can almost see that because Sienna, being the big breed dog that she is, these things are extraordinarily large. And as you can see, the blood comes readily out of there, and there's no fuss because there's very few sensory receptors on their neck, and dogs really just don't seem to bother that as well. So what we're doing here now is we're taking the blood and we're going to prep this for her early detection profile, which contains a heartworm test as well as the white cell counts, the CBC, or the complete blood count, which has white cells, red cells, all the indexes, examines the individual red cells and white cells for any abnormalities. We're also going to go ahead and test her liver function, kidney function, blood glucose, and electrolytes as well. So these are some of the things we recommend on an annual basis for her. And once we get the results of that test back, Sienna is going to be started on her heartworm preventative, which we have them maintain on a monthly basis year-round, depending on the person's preference. As Ashley mentioned earlier, most of the heartworm preventatives that we have and recommend for use at the Harvard Veterinary Clinic also control internal parasites as well, and some of them also control fleas, like the sentinel. We recommend that those guys be given on a monthly basis throughout the year, and then for the heartworm preventative throughout the summer months.